So that picture of Jerry Sandusky conjured up all kinds of things for me personally. And there are upsides, as Dr. Finkelhor mentioned. It's given me great license to talk to my 15-year-old about the whole issue of sexuality and what's appropriate and what not. Ironically, in talking with her, I found out that she knows a whole lot more than I do about the subject. So I don't know if that's good or I think that's a good thing. So I'm going to introduce Dr. Keith Kaufman, and I'm going to take a little bit of license here because Dr. Kaufman does have a real, whether you know it or not, a real soft spot in my heart. Yeah, you do. So Dr. Kaufman, first of all, is a professor, a clinical psychology professor at Portland State University. And he has in the past served as the department chair from 1998 to 2007. So now I'm going to just kind of deviate just a moment here. I am not an academic. I mentioned that. And at the beginning of this fall, I'm a Husky, the University of Washington, traveled down to Louisiana State, and they got pulverized. It's like 53-3. I mean, it was 43-3. I mean, it was just demoralizing, and I thought this is the beginning of a horribly dismal season. But there was light at the end of the tunnel. The following week, we played Portland State University. We beat them 50-something to 20. In that one subtle move, you uplifted, you raised the self-esteem, the self-concept of 80 demoralized football players. I want to thank you, Dr. Kaufman. So Dr. Kaufman, while in Oregon, he has served in many capacities. He's currently the president of the Association for the Treatment of Sexual Abusers. He is considered one of the foremost experts on the assessment and treatment of both child sexual abuse victims and juvenile sexual offenders and their families. Dr. Kaufman has done extensive research on the prevention of child sexual abuse and the treatment of adult and juvenile offenders. He is, in particular, currently completing and we talked about this briefly, child sexual abuse prevention study funded by the CDC, Centers for Disease Control, looking at risk factors related to offender modus operandi and parental supervision across 3 ethnic cultural groups. And I'm told that the analysis of the data is going on right now, and the results should be published, I'm sure, at some point in the future. Dr. Kaufman tonight will present ideas related to child sexual abuse prevention strategies, including his extensive work with Boys and Girls Clubs. Please welcome Dr. Kaufman.
Well, thank you. I'm very honored to be here. And I just want to say that one of the really wonderful things about speaking around the country is the fact that most every team that plays Portland State beats them. So people are always very kind to me. But I'm very excited about being here this evening to talk a little bit about the prevention of child sexual abuse and how to enhance prevention. And let me begin by saying that the American Medical Association has described child sexual abuse as a silent, violent epidemic. And historically, if we take a look at the response, both in terms of monetary investment and also service to child sexual abuse, unfortunately, we've invested most of our money in after-the-fact services and treatment. And that's not to say that that's not a good place to put money, but that's meant that there's been very little money left to invest in prevention. As a matter of fact, Prevent Child Abuse America estimated that for every dollar we invested in after-the-fact services, we were spending a single penny on prevention. Now, this is particularly critical because what we know is, as George Albee said, no mass disorder afflicting mankind is ever brought under control or eliminated by attempts at treating the individual. And so clearly, part of my talk this evening, and it's probably most likely singing to the choir, but is that we really need to enhance our investment in prevention both in terms of our personal commitments and the time we're spending, but especially in terms of our investment of dollars. With the short time that I have this evening, I'd like to do two things. First, I'd like to talk about some strategic ways of approaching prevention to enhance what we're doing. And I'll start by talking about a general prevention model, and then talk about some of the key factors and how they apply to the prevention of child sexual abuse in particular. And then the second thing I'd like to do is very briefly tell you about a project I'm very excited about, working on a collaboration with Boys and Girls Clubs of America on a sustainable prevention approach that they can use with their 4,000 plus clubs across the country. So I want to tell you a little bit about that. So here's the part where, much like Kip's introduction, I want you to not quite close your eyes, but I want you to imagine yourself walking down this river. And I want you to imagine that suddenly you're not alone, that unfortunately there's someone in the water that needs your help. And what do? Well, of course you offer them some kind of help. Now I'd like you to imagine further that within a short period of time, it's not just one person in the river. There's a whole host of people in the river. And what do? Well, first off, you find a better river to walk next to, right? But the second thing that you hopefully do is you find a way to help all of those folks who are in the river, right? That makes sense. My hope would also be that this is the point at which you decide not to spend your time standing by the river giving out life rings, but instead this is the point where you start to look upstream. And this is the point where you start to ask yourself questions about what are the risks that have led to these people being in the water. And if you were to do that, this town or city, what you might find is that there's this absolutely horrendous bridge that people insist on using as a shortcut. You might also find that this is part of a party city, and the people go out on the boat, and unfortunately they drink while they're on the boat, and that means that some of them end up in the water. And moreover, what you might find is that local business and industry isn't as good as they should be about safety precautions for their workers. And further, that this is a hot spot for children and for teenagers for playing, and there aren't always adults to supervise them. Now, I don't want you to misunderstand. I'm not saying that we shouldn't be throwing those life rings to people. Clearly we need to do that, but we really need to ensure that everyone knows that throwing those life rings is not enough to solve the problem, because that's what we've been doing for 30 years. If we're really going to make strides in terms of eradicating sexual violence, we really need to be thinking about how we strategically go about enhancing prevention. Now let me start by talking about some strategic moves, because we're concerned about all those people in the water. And then in a minute I'll talk about child sexual abuse. I want to talk very briefly about two forms of prevention. Lots of different definitions of prevention. But here let me start with primary prevention. When I talk about primary prevention here, I'm talking about prevention that's directed towards the general public, that's intended to enhance knowledge, attitudes, skills for healthy living and to prevent risks, and it's applied prior to the onset of risks. I'll also be describing efforts for secondary prevention, and when I talk about secondary prevention, I'm talking about efforts that are directed towards at-risk groups. So in our more general example, we might be talking about people who work on the river as at-risk people. And here we're seeking to reduce the risks that could lead to the problem, and it's applied after the risks exist, but before the problem has actually manifested. So let's take a look at some strategic advantages of looking at enhancements and investments in prevention. So first off, one of the distinct advantages is the fact that looking upstream and investing in prevention offers us a chance to intervene at multiple levels. So for example, we could start by, at the individual level, teaching more people to swim, making sure that they have personal flotation devices. At the relationship level, we can be ensuring that more parents are at the riverside and in the water and supervising their children. At the institutional level, we can make sure that business and industry takes safety seriously, make sure that their workers have the right equipment. And at the community level, we could make sure that the sheriff's department is patrolling the waters, making sure that those partiers on those boats are having fun, but not ending up drinking too much and not ending up in the water. And finally, at a societal level, we can look at standards for bridges. And we can look at whether or not our rickety little bridge is really anywhere near meeting that standard, making sure that people are intervening. We can also look upstream to look at creating a better balance between our investment and after-the-fact services and prevention. Here the contrast is the person standing downriver throwing rings to try to pick the people out of the water, as opposed to all the people that we can get to participate in prevention, from the individuals who are being taught about swimming, to the workers, to the sheriff's department, and to parents. So prevention really offers us opportunities to include everybody in the solution. We can also be strategic with prevention, where we can pick out particular levels that we're not intervening sufficiently enough. For example, here at the societal level, if we go look at the literature on bridges nationally, we find that on any given day there are thousands of bridges that don't meet standards and really aren't safe. Although I'm not sure they were talking about that bridge. We can also work on creating that balance, as I mentioned before. We can be investing in things like more patrols. We can be investing in putting more lifeguards on the riverfront. So that's the general case for prevention. That's what we need to be thinking about from a strategic standpoint. So let me talk just a little bit about how that now applies to the specific case of doing better about preventing child sexual abuse. As I said earlier, one of the distinct advantages is that we can intervene at multiple levels. What we know is when we intervene at multiple levels, our efforts are much more effective. So here at the individual level, we can be ensuring that every youth has exposure to school-based, child-focused prevention, much like what Committee for Children does every day. At the relationship level, we can make sure that the information is going out to parents to support those kinds of skills and attitudes and knowledge information. We can make sure that parents know more about looking out for what it means to be looking at grooming behavior, or what it means to understand children who are demonstrating at-risk types of behaviors themselves. At the institution level, we can help schools ensure that they themselves have the kind of policies that promote healthy relationships and that there are reasonable consequences when youth at school engage in inappropriate behaviors. At the community level, we can use some of the wonderful things that we've learned about bystander intervention to include people from across the community to intervene when they see at-risk behavior. And from a societal standpoint, we can be better about intervening with the media, trying to get the media to have more appropriate messages a greater amount of the time. So intervening at multiple levels simultaneously to be more effective with prevention. We can also think about tipping the balance back in favor of a sufficient investment of services and money with regard to prevention. And what that might look like is increases in federal research funding, prevention program funding. It would include looking at what we do in terms of investing in both victim and offender prevention efforts. And I would say that the argument, the one that we hear most often about why there's not more money for prevention, is because it's all spent. Well, part of my answer to that is there are a number of places that we currently put money in communities and in states where the research data suggests that it's not keeping, those strategies are not keeping the community safer. I think we should get that money back, reinvest it in programs that are evidence-based and that would move things forward in terms of the eradication of sexual violence. I also mentioned that one of the things this approach allows us to do is strategically look at areas that have been neglected. And David had mentioned this in his talk. I think that one of the areas that we have neglected is institutional or youth-serving organizations. And let me tell you a little bit about why I feel so strongly about that. If you take a look at the data, it's an understatement to say that a large number of youth are involved in youth-serving organizations. Every day we send more than 57 million youth to school. Estimates are that more than 41 million youth participate in youth sports. And that doesn't include the smaller youth-serving organizations that count in the millions the number of children who participate in their programs, like Boys and Girls Clubs, Boy Scouts, Big Brothers and Big Sisters, and there's a whole host of them. So clearly, there's a large number of youth who are involved. At the same time, I don't want to mislead you. Most of these organizations, especially the big ones, do invest efforts in creating a safer environment. But at the same time, we know that there are still children and teenagers who get abused in these settings. And unfortunately, there's no national tracking, but we know this from the general media. We see these stories all the time. They're easy to Google. Some of them, like Sandusky and others, become part of our daily life for long periods of time. We also know that organizations that have less resources probably represent more of a risk because they don't have the resources to invest in some of the safety things that we'd like to see. So that led me to a collaboration with Boys and Girls Club of America. My contact there, or my collaborator, is Les Nichols, who's the Vice President for Club Safety and Design. And we had some wonderful funding, or we have some wonderful funding from the Pennsylvania Coalition Against Rape, and we have their Vision of Hope grant, which is a 2-year grant in this case. The goal of this project is twofold. First off, as I mentioned, our intent is to create a self-assessment approach that any or all of the 4,000 clubs across the United States can do on their own. And it has to be low or no cost, it has to be sustainable, it has to be something that can be done simply, it has to be something that's comprehensive, and something that can be tailored to 4,000 different types of settings. The second thing is once we have that model, is to look at its effectiveness. And just to give you a little bit of detail on this, this approach is based on something called situational prevention. And actually, situational prevention has been used successfully for more than 70 years around the world to create safe housing, for more than 20 years in crime prevention. It focuses on, pretty simply, identifying all the risks in a particular environment, and then either creating prevention or risk reduction strategies to respond to those risks. It's also a particularly good fit for youth-serving organizations. Let me just take a minute and give you a sense of what are some of the areas that we look at as part of the brainstorming. And I'll point out to you that this center white area are the dimensions that the clubs have a little bit more control over. The black area around it are the dimensions that exist in the community that the clubs have some control over, but not quite as much. So we brainstorm around areas like at-risk characteristics of youth. So that might include youth who come to the club particularly emotionally needy or developmentally delayed, or it may reflect their family situation and difficulties at home. We also brainstorm around specific locations that are high-risk locations in the club, on the club grounds, and in the places that the clubs go to as part of field trips and as part of their summer camp. We also look at what we call facilitators. So for example, on a nice June day, when people would rather be somewhere else than work, if you have a bunch of people who go ahead and call off work, that changes the staff to youth ratio that creates a risk. We look at issues around health, like mold in the wall. We look at accident prevention. It might be a broken sidewalk or old gym equipment. We look at physical safety concerns like conflict between youth. We also look at club policies. Are they there? Are they the right ones? Are they ones that are actually shared with the employees? Then moving to the community, we look at community policies that impact the youth. If the youth go to a community swimming pool, they bump into community policies. We also look at the lifestyle and routine activities of the families. If you have a single parent who works 2 jobs, they may have to drop their youth off an hour before the club opens in the summer, pick up that youth an hour after. We look at what are the larger risks in the community environment. Some of the clubs we worked with, 40% of the buildings in the area were abandoned. There's gang activity. I should mention that those are the 7 areas we brainstorm about. The model also pays attention to things like offender issues. How many are in the area? How well are they supervised? What kind of treatment do they get? And of course, we also attend to the influence of socioeconomic factors. So this gives you a little bit of an idea of the risk assessment that we do in the brainstorming. In the first year, we worked with 7 clubs across 3 cities, Philadelphia, Pittsburgh, and Portland, to develop the model. That led to the development of an implementation manual that we're just starting to use to test out in 16 different clubs across 4 different states to look at satisfaction and effectiveness. What we hope to do in the future is expand this model to look at how it works with other organizations. We've done some things with children's hospitals. We're starting to have some discussions with faith-based organizations, and we're also going to work on measurement. The last thing I want to mention to you is going back to that idea that prevention offers a role for everyone. Now, you'll be getting in the mail, in your email, a copy of this talk. You'll also be getting a handout with some resources. But I'll very quickly mention to you that there's a whole host of things that we can offer to different groups to be participants in this solution. Parents can seek out information. They can learn about ways that offenders groom. They can work on their communication. Professionals can make sure that they're actively screening as part of their practice. Can make sure that they're educating parents and other professionals. They can also be advocates and experts in the development of prevention. Children and teen, just the kind of work that is being done by Committee for Children, development of strong basic skills. We can teach them where to look for help. We can help them develop healthy relationships. And as teenagers, we can make sure that there's a focus on healthy sexuality. For community members, we can have an emphasis on what are risk factors, early risk factors, and how can we empower them as bystanders to intervene. Albert Einstein said that intellectuals solve problems and geniuses prevent them. Please be a genius. Find a role, find strategies that fit for you, and make prevention a part of what you do every week. Thank you.